Hi there, I'm Jason Reed from LEAP UK, which is Law Enforcement Action Partnership. And we're composed of law enforcement members from across the spectrum, chief constables, MI5, undercover operatives, even military, all now campaign for changing our attitudes and our policies towards drugs. We need to think in different terms. We don't need to think in terms of the drugs, but the people behind them, but also in society. So society pays £400 per year per taxpayer to keep this policy afloat. We also know that 1.6 billion gets spent on enforcement. So is it working? No, unfortunately not. It's actually doing more harm than good. Each year, the incidence of drug-related death has been increasing. So in Scotland, we've now got the highest rate of drug-related death in the EU. Last year, it was over 800. It's increased to over 900 people this year. Same for women. Even though they consume less drugs than men, women are now dying at a higher rate. We've seen a 95% increase last year, and it's gone up again this year. And in England and Wales, drug-related death has also risen. So what's going on? The law is supposed to deter people from consuming drugs. Unfortunately, what it does do is deter people from seeking help and treatment. We know that the harshness of a country's drugs laws doesn't impact on the rates of drug use in that country. The Home Office report found that out a few years ago. But we also know that from Portugal in 2001, who decriminalised drugs, that once you do that, people don't consume at any higher rate. People don't tend to factor it into their decision process. It's based on far more other factors than that. But if you do have a relative that's suffering with a dependency to alcohol, prescription drugs, even food, then the chances are you know that there's more at play than the drugs themselves. It's going to be mental health, it's going to be their life circumstances, what's gone on in their past. But what our drug laws do is it differentiates between who can seek help and who can't. So if you've got a dependency to alcohol, you can have an open conversation about that. We'll understand it. We can have an openness. But if you've got an addiction to drugs, what we term illegal drugs, then you can't really go many places without being in fear of criminal reprisal. And this is what we need to sort out. We need to make sure that people that may suffer have got somewhere that they can go, a culture of openness. So what can we advocate within this? There's various different steps. People get very afraid by the term legal drugs. It infers this free-for-all, but of course it's not that simple. There's far more to it than that. What we can have is a regulated system for cannabis, which means that we can collect money from the tax revenue of that, which could be quite substantial. It can be in the billions. What we can do is put public health models onto that. So we've lessened the rates of tobacco. And the reason we've done that is through education, through banning advertising. We can do that with cannabis. We can look at other models from across the globe. The United States has started legalising, and again, I use that in quotation marks. But we've also got different models as well, like small cottage industries, like in Spain, cannabis social clubs. What they did is they had cooperatives. People got together, sorted their own supply chains out. And what that does is cut the ties to organised crime, because 320 billion per year globally goes into the hands of organised crime because drugs are illegal. Now, what we need to do is think differently. As I said, we've got a potential avenue for legalisation of cannabis. And again, I'm using simple terms like legalisation, decriminalisation. I don't usually use those terms, but for the sake of shorthand, we're going to go with that. We've also got terms like regulation, which again, it meets a more responsible mindset. But what we also need to think about is safety. And what we can advocate within that is drug testing services like currently going on as we speak, the Loop. There are a bunch of scientists that get together at festivals and nightclubs. And if you've got a child that's going out to these clubs and festivals, or a friend or a relative, a brother or sister, what they can do is they can go to these frontline services, put their drugs on the table and say, can you test that for me? And they'll find out if they've got what they think they've got in those substances. So if they think they're taking MDMA, let's get it tried, tested, see what happens. And what the Loop are finding is that people aren't consuming what they think. So there's lots of adulterants like concrete, malaria tablets, PMA, which is a far more stronger version of MDMA. what we can do with these services is give people right advice. So you can say, right, only take half, come back to it later. Drug-related deaths can go very much down from that point on, through education, through an openness within the culture. And then we need to think in terms of people that may have an addiction to opiates. And opiate deaths have been increasing. So the ACMD, which is an advisory council to the government, they found out that there's nearly getting over to 3,000 deaths now because of opiate-related overdoses. So we really need to do something about this. And what we're finding across the globe is that people are setting on this model of drug consumption rooms or safe injection facilities. It'll be a place on the high street or somewhere out the way that people can go get services that they need, clean needles. They don't have to discard them on the floor, which we cut down on drug paraphernalia litter on the street. But we also can have a service which gives people help if they need it. And the funny thing is we kind of already do this. If you go to your local chemist, they may have a methadone program. They may have banners on the side saying, if you're suffering with a drug dependency, seek help. Don't talk to someone, don't suffer alone. So we know that compassion and health models work, and yet we're not pushing them out further. We're not looking at the evidence. So what drug consumption rooms are is, as I say, a safe place that people can go, consume the drugs that they consume, services that they may need. And what we can do also is have heroin-assisted treatment. So if someone is suffering from a dependency from heroin, then they can get it prescribed, which means they're not getting adulterants. It means that they're not suffering through the hands of going to a dealer that may be connected to organised crime again. And these are all different models that we can employ that we know work across the world. So don't think in terms of legal and illegal drugs. I know I used the shorthand at the beginning, but think in terms of regulation, but also think in terms of people, actual people that you know. So if they do suffer with dependency, how would you like to get them treated? Through prison system or through health models and doctors? It's pretty much that simple. So this is why we need reform. And this is why reform works. And this is why people across the globe are grasping this issue and actually pushing this forward to make sure we get health models instead of punishment. And what we do within Leap UK is we've got this broad spectrum of speakers so that people can understand this issue, because people like to listen to someone from a law enforcement perspective. They trust a chief constable or a PC or an undercover operative. They trust doctors as well. So when doctors and law enforcement are getting together and agreeing that we need to have a support, don't punish model, we need to have sensible regulations, we can actually do something to improve public health. And that is why we need drug policy reform.